Hello, and welcome to TouchPoint with Tayo, the show where everything matters. I am your host, Tayo Oweye, and on TouchPoint, we engage Africans' realities. We also explore vital issues that concerns Africans in the diaspora and beyond, educating minds and addressing trendy issues. Daylight savings has ended. We're starting year seven. West African time is 8, and it is 2 p.m. in the North America, EST. And this is just how the world rolls. And today on Touchpoint, we are discussing patience and joy, motherhood after years of waiting. I have my guest joining me live on Touchpoint with Tayo in the city of Glasgow. She's a general practitioner, a wife, and a mother. I have Kemi Ishola with me. Hello, Dr. Kemi. How you doing?
I'm fine, thank you. Thank you for having me.
You're welcome to Touchpoint with Tayo today. You can join our conversations as we're going on. As you're watching on YouTube today, you can join us. And you can also email us on touchpointwithtile at gmail.com. Send us your comments. We would like to hear from you and your contributions on the topic patience and joy, motherhood after years of waiting. There is um, a statistics according to WHO that says that 17.5% of adult population, roughly about 1 out of 6 people of reproductive age worldwide experience infertility. In the UK, it is 1 out of 7. That is high. And it's an issue that causes anxiety, distress among couples. I don't know who this anxiety or distress happens to more, but it is real. Emotional distress is real. But Kemi, let's start because we are talking about something real and something that you had gone through
Okay.
before. If you could go back, I'm going to start with this and give
Okay.
yourself one word of encouragement during the waiting years. What will it be and why?
Hmm. Thank you for taking me back. I think there's several words I would have loved to tell myself, but you asked for one. I would
Mm,
have just said, stop being anxious. Just hold off on that anxiety. Just relax and
mm,
just stop being anxious.
mm,
Because, and you said why? Personally, because basically the infertility journey, it's
mm.
individual. Don't get me wrong. But
Yeah.
for me, even though in view of my background, my religion, my beliefs, I had faith, I believed in God, but I was still anxious.
Wow.
The anxiety was everywhere.
Wow.
And if you're to ask me to talk to my old self, I'll have said,
Mm,
Kemi, calm down, be
mm.
less anxious. Thank you.
Wow. 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 So if when you take um reflection, a thought about that journey, it's about stop being anxious
Yeah.
and just calm down. And let's look at some specific things about this journey of waiting and hoping. Um, what would you say were the most challenging moments along the journey?
All right. Um, I'll put it into maybe three, but with a 3A or B at the back, basically. I wouldn't want to classify it into four because majority of us might not really go through the four categories I want
Okay.
to simplify it into. So I
Mm,
will start with one of the most challenging one is I'm a doctor. And
wow.
here I am. My career was staring me in the face.
Mm.
I mean, that's just not to digress, but I remember while I was in medical school when my friends had gotten married earlier
Mhm.
and they were waiting, and I keep calling them and saying, "What's wrong with you? What's the difficulty in chatting your ovulation? What's wrong with you? You
Mhm.
just need to do this regularly." Because I was still a young student thinking, why are these people, what's the delay? I didn't look at the other picture that it was much more than just the medical part of it. So when I was then waiting in my third year, this same friend called me and said, doctor, can't you chat your own ovulation anymore? And that hit me below the belt. It was hard because basically I then understood that, look, it's just beyond. Yes, we know medicine definitely work, but it was beyond that. So that was a challenging part for me, both based on my career. However, obviously also based on your spirituality. I'm a Christian. I love God. I love to serve God. I do things of God. So I told myself, God loves me. He loves why. If unbelievers and all that can have kids, what's going to be my problem? So I just took it for granted and felt it shouldn't be a problem to have children. But then it was staring me in the face and I kept waiting. First year, second year, third year. And then those thoughts come to your mind saying, have I offended God? Is there something even though your Bible tells you there are waiting mothers in the scriptures, but you just feel, look, I shouldn't have to wait. And these are things that goes through the minds of the majority of waiting mothers, even fathers. You wonder, even pastors, people who serve God and do all the things. But it's right there in the Bible that Zechariah was in the temple and it
Yeah.
still happened to him eventually. But so that was another cause of my challenge, thinking, why is God not answering? And
Yeah.
then the third one was the social cultural factor.
Mm.
Meaning they see a couple, the woman is the one in trouble, particularly from the African culture. I mean, I've known a lot of Africans in diaspora and all that. It was always like, oh, a woman, maybe she can't have children or things like that. So it was a lot of pressure.
Mm.
And particularly when the woman is also thinking on the part of the age factor. And then I said the 3B that I was going to mention, which was a challenge, was the money was there, but money failed. Because
Wow.
yes, you had money to do a lot of interventions, investigation. I traveled to different nations, but it still didn't work.
Wow.
So those were very obvious challenges, and I know a lot of people are going through the same.
Wow. Mm.
Was there
Mm.
any other question you asked that I missed?
Wow. 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 So the major thing is, how did you overcome those challenging moments in the journey?
Okay. So would I say it's easy to overcome? The only time you can say you've overcome, obviously, is if you say, how did I manage the journey? Maybe.
Mm.
Because
Mm.
the only time you say you've overcome is when you have your bundle in your arms.
Yeah.
For managing the journey, basically, I would say it's your baseline should be the God factor
Mm.
because no person can give you that comfort. Now, the God factor should be baseline for both couples, both the man and the woman, because it's a difficult journey. And for me, the other factor that came after God was God blessing me with the most supportive, amazing husband. I cannot overemphasize it.
Wow.
The
Wow.
part of having a very supportive, God-fearing husband that would be standing there by you, particularly, and I will use this opportunity to actually talk to both singles and married, I mean, basically more singles that
Mm-hmm.
marry your friend because he was my backbone, he was my rock, more or less. But
Mm.
God definitely saw me through it, but with the help of a very supportive and caring husband as well.
Wow. 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 Kudos to the caring husband. Kudos to Mr. Ishola. So how did your, I mean, obviously you had relationship with yourself. So how did your relationship with yourself, I mean, and with others change over time as you waited for this moment? As I mean, the shift in that relationship, even with seeing yourself, I mean, I've not, I mean, it is when you are in a situation that you tend to like flashback more like some movies and you see yourself like this, is this me? So how did your relationship with yourself and others change over time as you waited?
So during the journey, okay, thank you for that. So basically, the relationship with myself, I wouldn't say it changed. However, because basically, when you say relationship with myself, well, the way people view me probably didn't change. But at some point, the way I viewed myself, when the cameras are not in view, where people are looking at you and everyone is seeing you, because nobody really sensed there was anything wrong, because I had a supportive husband. We were traveling, we were developing ourselves, which is one point I would obviously say to people, while you're waiting, just carry on doing positive things, developing yourself. When the kids come, you'll be telling yourself, well, why didn't I do this earlier? So basically take that time to do it. But coming back to your question, yes, relationship with myself, to everyone out there, didn't change. I was always my happy, bubbly person. I've always liked to play, to dance, to have fun. However, obviously, coming back to this supportive husband, he knows that after all the play and fun, I go back home and say, God, why now? How far? You know, you have those down moments, but then he will talk you out of it. Then thank God for the Bible. I go back to the word, and then I look at the women in the Bibles that went through it, that there was a purpose there, and that strengthened me through the journey.
Yeah.
Relationship with others. So with my family has been always amazing. I have very supportive and amazing siblings, because particularly when you see them having their own children, I wonder, these are children that I literally spoon-fed when they were growing up.
Wow.
But I was excited for them. However, I started sensing that people were a bit more sensitive to me. They were trying to be more, even though I'm a jovial, happy, bubbly person, people were trying to be more cautious with what they say around me, just not to get me offended. Some people were quite insensitive, so don't get me wrong. But
Yeah.
my siblings and families, in-laws, they were quite a bit sensitive. We were praying for you. You are doing, everybody was quite cautious and sensitive, which was a challenge somehow, because you wanted people to be free.
Yeah.
But then you start sensing, oh, or probably maybe I was the one sensing it, because basically I'm talking about my journey, where I felt there are some conversations they didn't feel comfortable having. I mean, take for instance, when one of my siblings got pregnant, they weren't sure how to come and share the news.
Break the news
But
with
like,
you.
break the news to me. Even though they know I'm happy about it, but it was also a challenge. And this definitely goes around with families. So it didn't change our relationship. That's to talk to my friends. And I know I probably had some people who were quite insensitive, don't get me wrong, but that didn't stop my being myself. Nothing really changed about me, other than my partner having to deal with the brunt of it when I'm always feeling low and moody. But he managed to get me out of it.
Something I picked is while waiting, keep moving.
Exactly.
While waiting, keep moving. And I mean, so how would it be like? I mean, someone have you actually experienced someone may unknowingly uh said a word that really like, wow, is it because of my situation?
Oh my God. It's not someone. There's so many things. So several times. Oh God. And I cannot overemphasize this. People have to be to be kind. That's the word. People have to be kind, because you cannot understand a person's circumstances unless you walk in that shoe.
Yeah.
So even apart from myself, although this is my journey, my husband, I've had people tell him things like, oh, you cannot know you are going on holidays because you don't have school fees to pay.
Mm,
That
mm,
hits below the belt. Or, oh, do you know where a church is? And you're like, oh, I don't know. Oh, it's beside one's park somewhere. Oh, but you don't know the park because you don't have children.
mm,
You know,
mm.
even though they're not coming from a bad place,
Yeah.
but these kinds of statements can hit below the belt for you because of what you're going through. Because if you have children, you won't be bothered about somebody telling you you don't know a park or something.
It's actually
And then there
below the
was
belt or actually
exactly,
in the heart.
exactly. And then, I mean, there was a particular one that actually dawned on me while we were reflecting, where a friend from a very good place, I actually denied that I even said so, offered, because I had so many friends offering, saying, Kemi, things have been happening. You've been doing things, you've been doing the IVF, it's been
Mhm.
failing. Is it that your body can't carry it? Let me help you carry it. And sincerely, it is from her heart, from a good place.
Yeah.
And I also was happy to hear that. But when I was in my down moment, as I always call them, I
Mm.
then think, so my friend feels I can't carry my own baby.
Wow.
You can imagine how deep those things. So we have to be very careful
Yeah.
what you say to people when they are going through this particular journey.
Mm, mm. Let me ask you. Um, if you look back into your yesteryears and you probably have something during your um, um, graduation yearbook that that colleagues used to have together, and we write quite a number of visions, things in the future like that there. So, like, how many children did you intend to have there? There? I knew I wanted five.
I don't know what's going on with you, man. My husband asked for six.
Six.
I think because you guys are not having the babies, you're just picking numbers. But if I look back, because if my friends are watching, I'm not sure I actually mentioned anything about children in the yearbook. But I
Mm,
know that at several points I'd had discussions with my families and friends saying, I just need three children, I'm fine. One of each sexes, the third one can be any. I'm okay with three. Even though
wow.
my husband was always saying, I want six. I know that kind of thing, but I was saying, look, if I give you three, just accept it or something. When I give you three, accept it. But I was comfortable with three.
It's as if things are not it men to be saying they want six. I think the women knew what they had to go through
True,
to
true,
have
true.
six.
I mean, don't get me wrong. My mom has five children, and God has been really good. And I actually, I think most people envy the kind of love and relationship we have. And I would have wanted that, but I'm like, five children in this present age?
Do you want
No,
to compare? Do you want to compare those times to these times?
no, 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 no.
They
It
had.
would definitely be
I'm
unrealistic.
sure they had quite a number of hands around, and
Exactly.
families were around. There
True.
are so many support systems around,
Systems.
much more than
Exactly. We do
what
here.
we our generation are actually
Yeah.
dealing with right now. We're dealing with quite a number of things. There was no climate change issue as at that time. Climate has changed, economy has changed, everything seems to be changing.
Very true.
So, if you are there any particular sources of inspiration or support that helped you through the journey? You've mentioned your loving husband, and kudos to him.
Yeah.
Are there any other sets of people that have been quite supportive in terms of during this journey?
Change the journey.
Yeah.
Okay. So I cannot, as I always say, that overemphasize the part of being a Christian. And to anyone who will listen or listen later, I always say, let the foundation you leave for your children, even for your words or anyone, be the love of God. Because throughout the challenge I faced, it was the strength. It was the strength I had to hold on to. You know, when you just have that strength that there's a God in this picture who loves me and will take care of me. So that was one. That was my major inspiration, and I was blessed to actually be under very powerful men of God. I mean, I can't but mention a few: Bishop Oyedepo, Miles Monroe. They all taught you to just hang in there, holding on to God. That
Mm.
was definitely my strong backbone. And as I earlier mentioned, my husband, I have, what they call when you are blessed with prayer warrior mother and mother-in-law. Ah,
I, I I understand that one. When you
I
have prayer mothers,
when your
prayer
mother-in-laws are
warriors.
warriors, that even when you are sleeping, you are hearing it in your dream that these ones are praying. Yeah, I am blessed with that. And then obviously my in-laws, I have amazing in-laws, families, my own siblings as well. I mean, that goes a long way. If that's support, and don't get me wrong, the church, the community, there's that group, which is why I said yes, God is the background. Having ministers of God to teach you, help you through the journey. Obviously, praying mother-in-laws and father-in-laws, father-in-laws and mother-in-laws, families, and it goes a long way. Those were my backbone, more or less, that went help me through the journey. And some very prayerful friends as well. Have
Mm,
praying friends, though. I would say that to anyone in the world. Have friends that can pray.
right. Okay, so I mean, if have you ever had any course that you were jittering to pick up some people's calls, and you know that are this is this what you want to talk to me about? You already have where the conversation will start. You knew the
and where it's
question,
going to end.
you knew what it will end, and how you won't know how to end it. Do you have
Very
people
true.
like that? They are not like in their own way wanting to like do anything to you. But do you have anyone that you just pick up your call and say, uh-uh, ain't picking this one out today.
True. Oh my God, the journey. I mean, I have them loads. I wouldn't lie
Mm,
because basically you will encounter different shades and people, and everyone comes in their own shapes and sizes.
yeah,
And but what I used to put at the background is they is probably from a good place,
yeah,
because if you don't have that at the back of your mind, you will make enemies everywhere because you are
yeah.
very sensitive at that point. So
Mm-hmm,
yes, don't get me wrong, there were people that when I see their call, I'll be like, oh God, how do I deal with this? Some
yeah,
I pick, and to be honest, some I don't pick. And I think the benefit of being in the diaspora helped me to escape some of that, because I know some people who are back home because of the pressure. You can't expect escape them when they come into your house. Are you going to not open the door? No.
mm-hmm,
But
mm-hmm.
if you can keep it at the back of your mind that they're coming from a good place, of because they also want it. Because this child, even though it's your child, they see it as their child and they
It's our
want it to
child.
happen. So at times I mean, don't get me wrong, they are trying to offer support, which I will also want to buttress that if you're
Mm,
going to offer support to someone, particularly a couple going through a journey, offer the support to them the way they would want it, rather
yeah.
than the way you feel you want to give it to them. Because
Mm,
basically,
mm,
you imposing it on them is enough pressure.
yeah.
But if they then decide within themselves, this is what we want, they can then handle the challenges that come along on the way that by themselves.
Wow, wow, wow. So don't put pressure on those in the waiting period. They have their own pressure. So bringing external pressure to them will be double pressure, and they may not be able to um, take it. So you had touched on what you are in partner, your partner really did on keeping your hope alive. Would you want to like expand what were the things you were doing to keep hope alive during the years of waiting?
Of
Someone is
waiting.
out there wanting to know what were the fun things these
What were
guys
they
did.
doing? Okay, all right. That's very true, because you definitely need to keep going. So for us, we were friends before we got married, and that's why I keep emphasizing marry your friend.
Mm,
So, and he by saying he's been my support every time I start getting to that my lows, because basically I would not lie, I had my low moments. He would
mm.
keep telling me, look, I didn't marry you for children. I married you to enjoy life together.
Wow.
So
Wow.
basically, we traveled,
Mm,
we did fun things. There were times we go like, this woman, you're eating my food too much. Let's go to the gym.
mm.
We played sports. I mean, basically, we went around the world. If you could afford it, why not? And then even if you cannot, you go on walks. You talk about things, because obviously we went to the same university. You talk about things. So you talk. You watch movies together. You pray together. You know, just carry on. And then we worked at developing each other. He was developing his business. I was developing my career. We had something to always talk about, so that, because when you're both not, if somebody's sitting and not doing something, and he's angry and upset, you are angry, and so
Mm,
there's always fire that would then bring up problems. But if you guys
wow,
are doing something, positive things, there's so
mm,
many things you can do. It depends on individuals, on your circumstances, but because the journey is different for individual people, I can
yeah.
overemphasize that one.
Okay. So even while you're going through this journey, how did you navigate the healthcare aspect of it? I can see that you are like, I
Okay.
mean, the healthcare
Because
aspect, especially the modern technology. And did anyone say, all these things that you are doing, is- why not just focus on God straight and don't mind
wow.
this modern technology thing? Is it good? I mean, just like a follow-up to that, if you answer that, is it good for someone waiting for maybe several years to tap into this modern technology? Has it been effective?
I would definitely and eternally advocate for it. As far as I'm concerned, I believe God gave these people this wisdom. So if it's there, why not harness it?
Hmm.
So now, even though, so because I've seen several, I have friends who were successful. I know there's always, as I said, there's always the God factor.
Yeah. Hmm.
And I would, going back into the technology, even being a doctor, it can be very funny. They've always said it that doctors are the worst patients, and I can assure you, we
They'll
are.
say, they'll say, doctor, heal yourself.
Yeah. So basically, what happened in my case, when we define infertility, they say, oh, inability to conceive after
Hmm.
regular sexual intercourse
Mm-hmm.
for a year.
Hmm.
By 6 months, me, I couldn't wait for a year. I was already on my husband's neck and saying, if it's not happening in 6 months, I don't want to know. Let's go out and find out why. So
Wow. Wow.
as you said, modern technology, how do you want to find out why? Definitely do some investigation. Like I remember there was when we were in Malaysia and the doctor looked at us and said, you guys should just kiss and get pregnant. Oh God, that hits me hard because he was telling me to my face that I had what they call unexplained infertility. He
Wow.
looked at my husband, there was nothing wrong with me. Him, I had done all my tests, there was nothing wrong with me. So he just said, you both should go and kiss and get pregnant.
So it wasn't that nothing, there was just nothing wrong.
There was nothing wrong. And several couples all over the world are going through the same thing because basically, as a GP, I see this all the time. And it's a bit more difficult for couples like that because at the time, my husband was saying something like, if there's something we need to treat, then I will know we are treating something. But this one,
Mm.
I don't understand why there's nothing to treat and it's not happening. So,
Wow.
but I would always advocate that if you've been waiting, I mean, after 1 year and it's not happened, just as they define infertility, if you've tried for a year and it's not happened, go and investigate because a lot of people have issues. People, men with low sperm count, women with ovarian cysts, all sorts of medical issues can contribute to infertility. So why not find out early? Because the earlier you find out, the earlier you can tackle it and then take it from there. And so also, obviously, the IVF, there's so many things. So yes, there's the God factor, but if God makes it possible that these people have that knowledge, he gave them the knowledge. Why
Mm.
not harness it?
Mm. You are allowing me to read a part of the scripture that says that God delights in concealing things.
Mm,
Scientists delight in discovering
covering
things.
things, exactly.
Wow. So, um, as we exhort and pray to God, we should also put things in action. More like putting our faith to action.
Exactly. So faith without works is dead.
Mm. Mm.
Because what would you want to even pray about if you don't know? That's the way I always go around it. So in my case, obviously, I've done investigation. If I'm going to be praying about low sperm count, then I know, oh God, please heal my husband's low sperm count. Because basically I know what the problem is. But if you then don't go for investigations or you don't even try, I mean, to me, faith, there's faith, but you actually going to get the works done is still part of it. So yes, I'm a Christian. I advocate that you still trust God, but wisdom is profitable to direct. You don't say I trust God and don't do the right thing. I wouldn't say I trust God
Mm.
and sit down and not go to work and then
Yeah.
I want to be rich. What are we talking about?
Mm. Two questions in which I want to just ask there.
Okay.
What were the prayer points for someone who is just praying, whichever religion? What were the prayer points?
Okay. For for me, because basically I'm talking about my journey, it
Yeah.
was easy for me to go through the scriptures because basically my foundation has always been the Bible. So I took my Bible and said, okay, what's the story in the Bible? What's happened? I looked for all the scriptures that related to women who were barren. I know the
Mm.
only woman that was barren till she died was David's wife, but every other woman that was barren had their children. So I
Mm.
told myself, okay, let me look for the one that would match my own. So I started saying, okay, fine. I don't want to wait till I'm 75 years old like Abraham, no. But let me find someone. So basically, you find your own scripture.
One that never had any issue of infertility that he
Exactly.
said just kiss and have the baby.
So you can pray. Obviously, your prayer would be individualized because basically, some people they might come and say there are some issues. Like I've had several encounters with patients that have had
Mhm.
blocked tube that had to be taken out, that it can't happen, that the only way can go is IVF. But
Mhm.
then the prayer is, where do I get money for IVF? So definitely that's an infertile couple, but praying for money to be
Yeah.
able to do the IVF. But there are other people that will say, okay, in my own case, honest infertility, I say, God, please just show me mercy. because I don't know where this is coming from. I don't know why I can't have children. There's nothing wrong with us. Show me mercy. So my prayer was all about mercy. But at least for other people, it might be something else. Oh, heal my husband's low sperm count, heal my womb, or things like that. So it's individualized more or less, but find your own word, be it in the Muslim or Christian, whatever religion, find your own scripture and believe that there's a God factor there as well.
How often should we pray?
Ah, yeah, you're pressing my buttons.
How often
Bible
should
says
we pray?
pray ceaselessly. I mean, I think most of us believe that prayer is when I sit down and pray. I pray anytime. I'm washing my plates, I'm praying. I'm in the toilet, I'm praying. Basically, it's not God. I think the way we see God is I probably differs. I see that He's always there. So even when you are doing basic things, just say what it's not until you kneel down or break a head. So Bible says pray continuously. So pray. I wouldn't put a time factor to it because obviously some people's jobs will say, okay, they work 12 hours, they want to sleep. But every opportunity you get, just say a word. He hears. That's the way I see
You may have touched on some spiritual aspects,
it. Okay.
on some social cultural aspects.
Okay.
What will you say about the economic aspect of waiting?
Ah.
Is there any economic burden to it?
It can be quite expensive. I would definitely say to that because I mean we're talking to people in diaspora to which obviously some help, the National Health Service is there for you to get some support into investigation and all that. But talk about people who are in Africa.
Mm.
You want to do basic investigation, you know the cost of it. So it's waiting is expensive. Well, some people just sleep and wake up and the baby is there. Some people are doing thousands, paying thousands of money to millions, even millions to pay to get this same test and the fertility treatment. So definitely, I would say waiting. Apart from the fact that it costs you financially,
Mm-hmm.
there's that cost emotionally.
Yeah.
There's that cost. Basically, it's expensive. That's the way I would say it. It is an expensive journey.
So, unlike someone who receives as she was touched,
That's the word.
some just receive as they were
As they
touched.
were touched,
In
yes.
fact, when they receive and they want to come out, some come out in multiple folds of blessings.
You're definitely
And
right.
yeah, let's can you describe the moment you found out that you were expecting? What were the joys that came to your mind?
Wow. Okay. How about I describe how I was telling myself that the day I find out I'll be pregnant, I will do so many things. And I mean, I had made so many noise of how I'm going to scream and shout and throw parties and throw tantrums and all that.
Okay,
But
so
then that was before.
let's see the imagination of how you are going to and
So
what you did in reality.
in reality, so your imaginations start changing. Once year one is going to year two, year three is going to year four, you're like, this imagination, I think I have to respect myself. So um okay. So my period was clockwork. I have never missed a period. Even when I did IVFs, my period would just appear. Bam. Even when they say, oh, they've taken 5 eggs out of me and they've put one back, my period would just show, despite all the treatments. Because basically, this was like clockwork. I never missed a period.
Mm,
So on this particular day, we've done a third IVF that had failed, and I told my husband would travel a lot. So I just went home for one of these holidays in Nigeria, and I was like, okay, let's just have fun. I'm not thinking about anything anymore. Because I told him at the third one that I'm done. That if
yeah.
God cannot do it for me, let it remain undone because He knows that I have tried.
Mm,
Because I've done everything that I knew. So I think this matter is about God now and me.
mm,
So I started carrying on. My anxiety was a bit more less then. I was just enjoying myself, and we were home, and I didn't know I was pregnant. So I came back and I was still a shop doctor, like a trust doctor then. I was even on a call. I just said that, oh, my period should be happening on the 28th of September, thereabout. So I felt, okay, 28th of September was something like maybe Wednesday or Thursday. I said, okay. So when I did see, I felt at times you get 1 day or 2 days, I'll just be extra. I said, okay, I'll give it. 28 went, 29 went. I was like, what's going on? Then my weekend on call started. So I had a very busy shift. I did the shift. So by something was saying, go and test, go and test. I said, I don't want to put myself in that kind of stress. I need to focus this weekend so that I don't start testing and then getting confused, because obviously if it then comes back positive, then
Yeah.
I will not be able to do anything at work. So I just say, you know what, finish your shift, come home, because I was doing a day on call shift, come home and then test. So I finished my shift, came home, finished, because I handed over 9 o'clock. I go home and I was like, oh, I'll wait for early morning urine. You know that feeling of, oh, it has to be your first early morning urine. I couldn't, because basically I was now 3 or 4 days late, which had never happened before. So
Wow.
by 12, I was waiting for 12 o'clock to click. So I was saving up my urine. No, you can't even imagine this journey. And then at exactly 12 o'clock, I was like, it's morning. I don't want to know. I took the urine and did the
Are you
test.
sure
And
it was 12 o'clock or it was
it was, I
11:57?
waited till 12 o'clock. I told myself it has to be the next early morning. So I told myself the very earliest morning, 12:01, I peed in the cup and I tested. I used the one that comes with the smiling face. I smell a smiling face.
Wow.
I sat down in the toilet confused. Am I dreaming? Is it real? Is it? I couldn't cry. I couldn't shout. I couldn't do anything. So I said, okay, this is 12 o'clock. I picked another cup. I picked another test kit. Dipped again. That maybe this one is misbehaving. It was still positive. I said, okay. So I sat there in the toilet and was confused. Me that had all the dreams of I'm going to do all the drama, I was just blank. I said, okay, the first person I need to inform is this man. I don't care if he's sleeping or whatever. He has to wake up and know this news. So I called him at about 12 o'clock. He wasn't still answered because he wasn't even around then. He was in Nigeria. Then he picked up, what's wrong with you? I said, look, we are pregnant. It's positive. I was like, I could hear it under his nose saying, thank you, Jesus. He was like, calm down, calm down, calm down. You know, when you say in Yoruba, just calm down. Because I didn't know I was screaming because I was like, you're pregnant. And I was still in the toilet. I said, calm down, calm down. Don't say anything. Wait till morning. Why are you doing? I said, look, I can't wait till morning. I need to let you know. So basically, we talked a lot. I can't remember most of the things we said. And I said, okay, fine. You go back to sleep. I'll talk to you in the morning. But remembering my prayer in-law, mother-in-law, my mother praying
Warrior.
mother. Even though my husband said, don't say it to anybody, just keep quiet. I said, close it to who? This woman is still praying. I just picked up the phone, called my mom, called my mother-in-law. My mother-in-law rolled from the bed. I can remember saying, Mutu bed. Something like I'm falling off the bed. She rolled and was saying, thank you, Jesus, thank you, Jesus. My mother would not stop screaming. I had to hang up the phone off her ear and said she was just screaming, screaming, screaming in my ear. And it was
Wow.
after I called them both, then it actually dawned on me. Then I started crying.
Wow.
Because basically you're like, after all these years, a urine test actually made me cry. So I just cried. So that was my own picture when it first happened. I
So if
couldn't
you're
stop
going to
crying.
look at the years, like from the day you got married, and so that was the span of how many years?
So I got married in July 2009, and that night was October 2nd, 2016. so, so that was definitely over 7 years.
Yes. Wow.
7 years.
7 years.
Mhm.
So, and you had shared how you, I mean, how you shared the news with your partner,
Yeah.
family members, and friends, and you probably shown the, I
No, I
mean,
actually just shared, sorry to cut you short. I only shared it with my husband, my mom, and mother-in-law.
okay. So, who else did you share with any friend or anything?
Oh,
Okay.
yeah, I remember. I shared with a friend who's just had a baby.
Oh, okay.
She's my very best friend. So I shared with her. So she was the only one that I knew here in the UK, but other friends and family didn't know
Oh,
until
okay.
after my first 3 month scan.
3 months. Yeah. So, what were the first things you prepared for, look forward to after receiving the news?
I don't think I wouldn't say there was that. I mean, basically, I was already thinking of the clothes, the bed. I was thinking of so many things, but I didn't really make any move. Because I forgot to mention, because while you're waiting, we all do, as Christians, we do what we call prayer points. So I had
Okay.
some baby's clothes I pray with. I actually forgot to mention that. I had some baby toys and things like that. I say, God, please, let this. In fact, there was a particular toy, not like a toy, it was a love teddy that my husband gave to me one of the Valentines. And I said, you know what, my baby is going to play with this teddy. And that was like 5 years after he had given me, and I still kept that teddy for my daughter to eventually carry and play with.
Wow.
So there were things I held on to. I wasn't really doing any shopping or buying until obviously after 3 months when I was sure that, okay, yes, baby's fine. Scans are saying everything is fine. Then that started.
So if you reflect um, back right now, I mean, your feelings about the way this moment arrived after such a long journey, what were those feelings? If you can put some
I don't think
emojis,
any I don't think anyone
emojis
can explain it.
into it, could be multiple emojis, and then what were those feelings like reflecting back? If you look at your face as at that point in time, was it like or what those feelings like?
I think people at workplace noticed quicker, even before I started mentioning it to them. You were just going to be, even when somebody insulted you, you would just be laughing.
Mm,
There was that joy unspeakable, full of glory. I then understood what it meant. You were just, nothing could touch you. And I
mm,
think since that moment, I have been able to carry that on, that even somebody insults me, I just be looking at you that, look, I have that joy unspeakable, full of glory moment that I have just made like a shield around myself that you can't hit me anymore.
mm,
Because that was how it was for me. It was surreal. I was like, something is growing in my womb. This has happened. There's
mm,
nothing else anyone can do. And
yeah,
that confidence was also there when everyone was saying, are you going to do the what they call this test we do to check for any abnormalities?
yeah.
And I said, I'm going to do everything because I know that this one God gave me.
Mm,
That was that so it's a surreal moment that you cannot explain.
mm, mm,
And it definitely will be different for different people.
Okay, so if let's look at how you embrace motherhood after that long period of waiting. So, how has that journey impacted the way you experience motherhood now that you have a baby?
Okay. it's eh, my God, I'm not even sure how to go around it, but basically, it's been an amazing journey. I can assure you of that. It's I was able. I think most of my friends would say, "Oh, you're spoiling this child," because basically, she was always with me. I'm always overprotective. I'm always like, "Oh, this is my egg. Please don't mess around with it." But even with all that, I still had to put that back of my mind that if you overspoil or pamper a child, to still bite you back in your bum or something like that.
Mm,
So I,
mm,
even as a baby, obviously, I did everything
mm,
that I should do to make sure that the child was happy and comfortable and all that. But as obviously growing older, I also put that into check that I have to also be disciplined about it. So in terms of motherhood, obviously that joy unspeakable full of glory was there that I could not
okay.
overemphasize. Yeah.
Okay. So just want to tell our viewers, audience, in case you have any comments, questions, I can see so many comments here online. Aju says we are here to learn and relearn, and Olatunde Ogunbiyi says I have always gained a lot from this weekly rendezvous. So, rendezvous, wow, thank you. Thank you so much. Uh, Okpeyemi Ogunle is a prayer warrior mothers. I can feel that. I
We
can
all
feel
need
that.
it.
Then Oyinlola Rotimi says that this is quite inspiring. And if one you would look at some moments with your child that you cherish most deeply, what were those moments?
Mm-mm. So I will tell you that every moment is cherished because this is your miracle. There's not one that I can isolate. The minute she came out, you're like, this is mine. And then
Wow.
obviously the anxiety every mother goes through of checking her every 5 minutes. Is she breathing? Is she doing that? But obviously when she starts speaking, and then every milestone was a joyful moment, I can assure you. So basically I couldn't pinpoint one. Obviously the most important one, which I know every mom try to listen to, is when you hear mama. I'm
Wow.
like, what my own is calling me mama, because I forget to mention all my siblings children call me big mommy, but now I'm having my own call me mommy. That was definitely,
Was that the first word she said, or it was
it was
Dada?
dada. It was dada. And it
Was
was
that?
painful. It was dada and it was
I'm
not
sure the
vex.
dad is like, hmm.
It was dada. And I don't know why they do that. Even though they stick with mom, they will still say dada first. It was
Wait,
dada.
why is what is it because Dada is quite easier to pronounce,
I
or
think so. Because I think so. I will
or
definitely
probably
confirm with my husband.
it is quite rhythmic
Exactly. And then all the da 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 they watch on the cartoon.
Oh
Uh
yeah, I
that
think it's all the
so that was a bit easier for them to start with. I think so. So don't
Uh,
quote me. But mine was a
wha-
dada too. So I was just glad to hear her speak anyway. So
Yeah. Okay. So, in what ways has your experience of waiting made motherhood more meaningful or joyful for you, or meaningful or joyful for you? It could be a
definitely
mix.
meaningful and joyful, because obviously um having because I've realized one thing about life, that every time you go through a challenge or a phase, there's
Yeah.
always something to learn, and
Hmm.
it's always for a purpose. So I I probably would be speaking for most of waiting mothers and mothers who have waited and also have kids. They they are more empathetic. They are more understanding. I,
Mm,
for one, became a bit more reflective.
mm,
I just didn't just see things on the surface level. I started thinking deeper and saying, you know what, you've been here before. This child is a miracle. I'm going the extra mile to say, no, I'm grateful. I appreciate this blessing. It's not that just, oh, because you know the interesting part when you're a doctor and you go to hospital and you're
yeah.
wondering, yeah, I've never smoked, I've never drank, I have been
Mhm.
faithful, I've been perfect. And a lot of mothers out there are like that. And then you see somebody smoking everything on a pregnancy and you be wondering why, how. So it gives you a better understanding of the gift you have, and also to tell other mothers or waiting mothers out there that this too shall pass, because basically it's a phase and it will pass. It's
Mm,
just the grace for us to be resilient. But for me, the that journey of motherhood, the joy there, you can't explain it. There's no way you can explain it to anyone,
mm,
particularly for someone who's waited. People
yeah.
who have kids normally will just say, "Oh yes, I have a baby. It was easy, popped out easily." But for you that had to go through phases of pain, crying, and all that, it's a bit more rewarding.
Yeah, yeah, yeah. So if one, I know there are several
Yeah.
moments for you. Is there any specific moment or milestone that made you feel, ah, this waiting is actually worth it?
There are several, oh.
So if you're
Several.
going to pick out of all of these moments, I
Mm,
know there are moments that you could frame,
yeah,
you could write quite a lot of chapters on it.
on it.
So, but you want to pick a chapter up and say, this chapter, I want to bring it up. And why would you say that milestone was worth a while, the wait?
Okay. There are several, as I said earlier,
Yeah.
and I think obviously her speaking and the the intelligence I find in her, and I'm like, oh, are you sure you're 2 years old? Are you sure you're 3 years old? It hits me and saying, and I am eternally grateful for that, because basically that's one milestone. I'm like, okay, fine. I'm hoping that she follows in my footstools. I mean, basically she goes in my, what's the word? She follows my track of being an intelligent child or something like that, because she learns quite quickly. And then her kind nature, growing up, seeing her grow, and she's always so kind, so always wanting to help.
Mm,
I mean, don't get me wrong, obviously, that's part of the milestone with her child developing. But you know, the particular one that hits me now is when I go for her parents teacher meets and they say, "Oh, she's amazing, she's perfect." She's like, "Okay, yes, God gave me perfection, so it was worth the wait."
Mm.
If that makes sense.
I I I I really love that you're seeing that this is actually a gift from God, and it was what the wait. I'm also looking at whether there are any questions online. So far, I think everybody is just enjoying the stories and really not. So let's explore how the journey has shaped you yourself, and how has the journey shaped your view of yourself,
Okay.
your view of your family,
Okay.
and what matters most to you.
So basically, the journey of 7 years is a lot of time, I can assure you. So it shaped me obviously about looking at life from a different perspective and telling myself everything, as Bible says, will always work together for your good.
Mm,
One. And then two, I've learned patience, I've learned resilience,
mm,
I've learned to manage my anger, my bitterness, you can't throw anything at me. I will
mm,
just look at you and say, look, I have been there, I have done that. And I mean, at times challenges kind of have a way of chiseling the bad characters out of you.
mhm,
And basically somehow it's managed to chisel out all those bad characters, to which I look at things and I smile, and when I feel I can't handle things, I can always go back to God. So for me, there was that faith, resilience, character remodeling, to which I don't get angry easily. I try to be to look at people and understand their circumstances and be able to also reflect as well as think about it, in that if I'm in their situation, if someone does something to me, basically, and I can reflect back and say, you know what, probably there was something else going on under the picture. So that kind of reflective mindset came up during this journey. Because if I had had a baby, maybe the second year of my marriage, I would assume everybody should have been able to do it. I probably not understand.
like it's just normal.
It's just normal. But having to have to wait and go through that, it
Mm,
made me understand that yes, people go through challenges. Mine was waiting. People have children with disabilities. People have circumstances that they are beyond your control. It's not like
yeah.
an exam that you say you fail and you know what, I can go back and read an exam and pass.
Hmm.
These are things you cannot do anything. It's just going to take that God factor.
Yeah.
So it's definitely changed my mindset to life overall.
Wow. Wow. And let me quickly ask this question because it was on our chat. Are you
Okay.
planning to go on to the journey for child number two?
I said in the beginning I
Almost
wanted
the
three.
person is TTT, is TTT. Uh, really wants to touch on the touch
On the
points. I
touch
want.
point.
I feel the person is touch on the touch point.
Definitely, why not?
Mm,
I obviously wanted three from outside, so I am definitely looking for God to do that perfect work, which He knows how to do best. I'm not rushing. I'm not. I'm not. I'm not going to be anxious about it, because basically, I have learned my anxiety didn't give me anything. The
mm,
Bible that has said, "Be anxious for nothing," has made it clear cut. So I definitely want more children. If it happens by God's grace, why not? Because I know He will always give us what we want. So thank
like
you for that
five,
question. Definitely looking
like
forward to
five or
more babies.
six.
Ah, no. It will not give us what will what will overwhelm us. I've seen people say I'm overwhelmed by my blessings. Mm-mm. I want blessings that would not too overwhelming. So I will stick to my three.
Okay, so before we go on, there's another
Okay.
question that says that from Oyinlola me says that can the guest um touch point on adoption as an option for infertility, especially in Africa? Is that a possibility?
As I said earlier, basically, there's several possibilities. I have a friend, and that's why I said it's individualized. Some people, when they've done the investigations, they see that, look, the circumstances are there, no sperm count, no eggs. Why not? Even those that have these factors still that they don't even have these problems. If you've waited for a while and you know the two of you can handle it, because going into adoption has to be a discussion within the two couples. It's not just one individual, because the two of them have to actually be prepared for it. I will advocate for anyone who wants it. But you shouldn't, I will say, as I said earlier, don't be the one pushing your support to the couple. It has to be their decision, because basically they have to live through it. I've had friends who adopted and then later had their own kids. So for IVF, IUI, surrogacy, adoption, I'm all game for it. But this journey has to be individualized, because basically you can ask me and say, why didn't I go for some of them? I went for the ones I felt and myself and my husband felt we could manage at that time.
Mm, mm, mm.
And we had okay.
Yeah. So if reflecting back, is there something you wish you had known or told yourself during the waiting years?
Ah,
What would it be?
let me quote Miles Monroe. Miles
Yeah.
Monroe said, God will show you the end
Yeah.
from the beginning, but he will not show you the journey.
Mm,
So I knew in God's word, I said I was going to have children. He has said it for all of us that we should have children, go out there and be fruitful and multiply. But Miles Monroe also said that if God showed you the journey, most of you will say, I beg, I don't go again. Just like in the case of Joseph, you are going to the throne, but
yeah.
you will pass prison. Joseph will have told him, keep your throne. But the point I'm still making is, if I had, it's not really easy to answer, because you don't know the time, and particularly because age is also not on your side, and the faith
Yeah.
factor will start shaking. I'll have told myself, just be patient and be less anxious. I
Mm,
will have said that to myself, because basically I know that, but I'll have told myself more and more that it was going to happen, but just because obviously the factors that you know. And the problem I think with medics obviously is because we know so much, it fights our faith.
yeah.
The medical knowledge is fighting your faith all the time. So it's a double whammy kind of battle for you,
Yeah.
being a doctor as well, being in that kind
Mm,
of journey.
mm. So if one you've made mention about those who supported during this journey, how they helped.
Yeah.
Um I wrote we used to have, like when you mentioned mentors, and you said tormentors.
Ah, true.
So how, let me shape it like this. Did the tormentors help you to stay focused? Were there any tormentors? Or did they help you to stay focused?
Well, maybe I mean, if you're not, when you're in the journey, you might think they are tormentors, but as I said earlier, that they probably are coming from a good place. Some are not coming from a good place, because some have
Mm,
very weird ideas in their mind telling you, go and try somewhere else. He too can try somewhere. Maybe your blood does not match. All sorts of things come through. But it made me just stay focused and stay glued to the God we serve. And the good thing is, obviously, my husband was also telling me, look, we didn't marry for children. If we don't
yeah,
have children, I still married you for, because I wanted to have a companion for life. So
yeah.
that helped us through the journey.
Mm,
So managing the tormentors, because I always felt, I look at the ones that I felt it was from a good place. Even though then might be a bit challenging to understand it, but I felt it was from a good place. I tried to be civil with them. That's the way I'll put it.
mm. Two more questions before we just wrap up, because
Okay.
we're just almost done today. I think you had actually also made mention on how friends and family should support waiting mothers, those who are waiting, and someone who intends to start to support someone in the waiting years. What skills do you think they should have to
You should
support those who
someone
are
waiting.
waiting?
Yeah. The very first skill is be kind, be sensitive, because basically these people are dealing. I mean, I saw in a particular definition that infertility is now called a disease, which
Mm,
is really not fair, because basically they don't really have an infection, but now they've given them a diagnosis like it's a disease. However, you should be kind, you should be sensitive. And as I said earlier, don't throw your support at them.
mm,
You can discuss it if they are open enough to open, they're kind enough to want to open up to you. You can discuss it at their level, but not throw it at them and say, this is what you should do, because
mm,
this is what I want you to do. Offer the support the way they would want to be supported, not the way you want to support them.
mm, mm. So In terms of if you were to pass, what are those specific values you want to instill in your child?
Ah, definitely God fearing. I would never, I mean, basically, I'm eternally grateful for my parents for that. I'm going to put that foundation there that she needs to love God. And then, because basically that would help her to face any kind of challenge in life.
Mhm.
Marrying, growing up, obviously, facing her life, career choices, being kind, being
Mm,
sensitive to other people, but also man her friend. I don't care
mm,
what just make sure that whoever you are picking is a friend so that you guys can go through this journey together.
mm, mm. So, if you could share one piece of advice or wisdom with other women on a similar journey right now, what would that be?
Okay? I would say waiting is tough,
Mm,
but you are tougher because you have a very big God. That's
mm.
my piece of advice to anyone out there.
Waiting is tough. You are tougher because you have a very big uh, God. I have quite a number of points coming in right now. Ajuo, just reiterating your point. I said we shouldn't push our views on others. In Bogota, we talked about why you made mention about the support and everything through talk. And I think Femi Shoba says, thanks for so much of these wonderful ideas that you are sharing. It's part of learning. And says once again, thank you. And if one, you had said waiting is tough, but that those who are waiting should know that they are tougher. If you have one shot to add to that, let's call it one shot to add to that, like a pattern shot for tonight. What would Kemi, let's say Kemi speaks as that, because I used to have that segment that I said, Kemi, my guest speaks. So Kemi speaks.
The one shot is don't give up on God. That's because that's what I lived through. So I would say obviously don't give up on God. Be patient,
Mm,
be resilient, because basically, as you mentioned, tormentors and people from a good place and they will throw things at you.
yeah.
So you have to have that cushion to be able to accept things so that it doesn't doesn't rock your boat.
Mm,
Uh, so Kemi speaks is definitely don't give up on God because the God factor matters. Even if you do any IVF or any modern technology, there's still always the God factor.
mm,
But be patient, be resilient, and then support each other.
mm. Remember, Kemi says, don't give up on God. Remember the God factor. Everyone around should be supportive of this uh, people who are going through this phase. It is called waiting. Even while you're waiting, keep moving, enjoy your marriage,
True,
enjoy your partner.
very true.
Don't let there be any dulling moment in your life. Thank you so much, Kemi, for coming to this today. I'm sure next week we are having a couple for this segment. We've heard of a mother's part of the waiting years. What happens? What are the dynamics within couples if one just come around next week and we will deal with this with a couple coming next week? Thank you, Kemi, for coming to Touch Point
Thank you
with
for
Ayo
having
for
me.
today. I would
It's
like
a
to thank
pleasure.
my backroom team, the researchers that always bring out this intriguing and deep questions, and the social media team. Thank you so much. And thanks to my listeners and audience. Thank you for joining us today and every week. And that is it, ladies and gentlemen, for tonight. And until next week, remember, these are my own words. These are my pattern shots. Life's journey unfolds uniquely. Run your race to attract grace, for it is only within the race that grace finds its way. I've been your host, Tayo Oweye. Join me next week for another exciting episode on TouchPoint with Tayo. Until then, I wish you a wonderful night rest. Good night.
Good night.
Bye.
Thank you. Bye.
Àti parí.